The title of today's e-poster is Dental Impression, Then and Now. As we are aware, dental impressions are the most important diagnostic tool used by the dental practitioner. And this poster will compare the conventional methods with the intraoral digital scanning systems. The conventional methods comprise of impression materials, which are impression plaster, impression compound, alginate, ZOA impression paste, polyvinyl siloxane, and polyether impression materials. The impressions are made using stock trays or custom trays. The conventional method requires recording the impression multiple times so in order to make the final casts or working casts. With the advent of computer-aided design and computer-aided manufacturing being applied in the field of prosthodontics, a concept of intraoral digital impressions was put forward in the early 1980s. It has drawn comprehensive attention from dentists and has been used for dental prosthesis fabrication in a number of cases. This new digital impression technique is expected to bring about absolute digitization to the mode of prosthodontics. The main intraoral digital impression systems currently available in the market include CIREC, Lava COS systems, iTero, E4D, and Trios. They vary from each other in terms of key features such as working principle, light source, the necessity of powder coat spraying, operative process, and output file format. We shall now have a look at the operational process of the intraoral digital impression devices. The patient receives a standard preparation of the abutment tooth under clinical criteria. To expose the margin of preparation, 2 retraction cords of selected sizes were placed in the gingival sulcus. After waiting approximately 5 minutes when the sulcus was expanded adequately, the area around the abutment tooth is rinsed and air-dried thoroughly for the scanning. If powder spraying were required in accordance with the manufacturer's instructions, a special sprayer is used to perform an opaque powder coating on the surface of the prepared tooth. Afterwards, the coronal cord is removed and secondary spraying is conducted to lay the powder over the area of the removed cord. The digital scanning process is then started. The operator grasps the scanner control to let the scanner tip slide towards the tooth from different directions for capturing images. Adequate pieces of 2D pictures taken by the scanner from several angles are critical to generate precise 3D data of the prepared tooth. A 3D stereo picture is displayed on the screen after the missing and incorrect scanning areas are analyzed by the operating system. The system can figure out if the scan is eligible for use or if a rescan is required. After the scan of the prepared tooth is completed, spraying and scanning on the antagonist can begin in the same manner. Eventually, a patient's buccal side scan at oral occlusion is taken to acquire a bite record. The final digital file output from the scan system is transmitted to the technician for further CAD/CAM process or applied for chairside design and manufacturing. Compared to a conventional impression, intraoral digital scanning can save time and steps for dentists and technicians. Steps eliminated at the dental office include tray selection, material dispensing, material setting, material disinfection, and impression packaging and shipping. Steps eliminated at the lab include plaster pouring, die cutting, trimming, articulation, and extraoral scanning. The intraoral digital impression technique has been used in prosthodontics to aid the CAD/CAM process. As a relatively new technique, the deficits in repeatability of the intraoral digital impression need to be solved, but dental products fabricated with intraoral digital impressions have presented accuracy on par with conventional impressions. Although conventional impression material like polyvinyl siloxane and polyether were developed and present great accuracy in many prostheses, the intraoral digital impression technique has a distinct superiority in work efficiency and saving of materials. The further improvement of the intraoral digital impression technique will lead to its wide use in dentistry. Thank you very much and have a nice day.